This is the Pick Your Poison podcast. I'm your host, Dr. JP, and I'm here to share my passion for poisons in this interactive show. Will our patients survive this podcast? It's up to you and the choices you make. Our episode today is called Miasma. Want to know the common way people are exposed to the chemical causing lung damage in microwave popcorn workers? What vitamin might be toxic for your lungs and how you can inhale heavy metals without welding? Listen to find out. A 16-year-old boy presents to the emergency department complaining of shortness of breath. He's had a cough and fever for a week. He's otherwise healthy with no history of asthma or lung disease. Mom says she took him to an urgent care a few days ago where he was diagnosed with a viral infection. The symptoms have worsened. Now he has shortness of breath and trouble breathing. The triage vital signs are as follows. Temperature of 103.2 Fahrenheit or 39.5 Celsius. His heart rate is 129 beats per minute. The respiratory rate is 40 breaths per minute, and the oxygen saturation is 93% on room air. The chart says no medicines, no tobacco, alcohol, and drugs. So, he has a fever, a fast heart rate, fast breathing, and an adequate oxygen saturation, but low for an otherwise healthy child. On physical exam, he has increased work of breathing with retractions, meaning you can see his clavicles and his ribs as he breathes in hard, trying to suck in more air. His heart is fast, but sounds normal. His lung sounds are coarse and roncorous, but there's no wheezing. He doesn't have lower extremity swelling, and the rest of his exam is unremarkable. What tests do you want? This is a pretty easy question. The main tests we need are a chest x-ray and a COVID swab. You might do some labs, including a white blood cell count and a lactate to evaluate for sepsis. Mom says the COVID swab was negative at the urgent care, so we can rule that out. This seems like a pretty straightforward case. There's a saying in medicine often told to medical students and residents, when you hear hoofbeats, think horses, not zebras, meaning common things are common. I love zebras, rare and unusual diagnoses, that's why I'm a toxicologist, but the evidence in this case points to a basic respiratory infection like a virus or pneumonia. The chest x-ray should point us in the right direction. You enter the orders to get diagnostic testing underway. And question number 1, what's the next best step? A, ask mom to step out of the room so you can speak to the patient alone. B, a breathing treatment. C, supplemental oxygen. Or D, antibiotics. The answer is A, ask mom to leave the room. Breathing treatments help with asthma or bronchitis. The patient doesn't have any wheezing. Antibiotics, of course, will help with pneumonia, but we need the chest x-ray to see if it shows this diagnosis. His oxygen saturation is fine, so extra oxygen won't help. What we need to do is talk to this teenager without mom in the hope, let me emphasize here, hope of getting the truth about sensitive topics like sex, drugs, and alcohol. In medical school, we learn this is an important part of adolescent medical care. And the good news is most parents expect it these days. I'll share with you that I learned to do this the hard way with adult patients too. When I was an intern, an older man complained of chest pain. It was obviously unstable angina, cardiac chest pain, so I wanted to give nitroglycerin to relieve the pain. He was taking Viagra. You may know nitro is contraindicated with recent Viagra use due to a drug interaction that can result in life-threateningly low blood pressure. With his wife sitting at the bedside, he said he hadn't taken Viagra for about a week, a safe distance in the past, so I ordered the nitro. Shortly thereafter, I returned to check on him. He was alone. His wife had gone to the cafeteria. He then disclosed he'd taken Viagra that morning, just a few hours prior to arrival. Clearly, not information he wanted his wife to know. Fortunately, nothing happened, but it certainly drove home the point about history taking with family members present. Mom steps out and you ask the patient about substance use. He continues to deny alcohol and illicit drugs. He says he doesn't smoke. When you ask specifically about tobacco, he admits to vaping. This is important, relevant information, and the case is getting more interesting. We use x-rays judiciously in all patients, especially pediatric patients, given the exposure to radiation. We don't want to x-ray children or adults for that matter every time they have a cold or an asthma exacerbation. However, a history of vaping in any person with respiratory complaints, even mild, might mean that an x-ray is indicated. Why? That's question number 2. Vaping increases the risk for which of the following diseases? A. Legionnaire's disease, B. pneumonitis, C. cystic fibrosis, or D. aspergillosis. The answer? B. Pneumonitis. Legionnaires and aspergillosis are infections. Cystic fibrosis is a congenital disease. Pneumonitis is inflammation in the lungs. Let's talk for a minute about vaping itself and then come back to the medical complications. I know we have some smart kids and teens listening to the podcast. Today's episode is especially for you, so you have the facts to continue making smart choices. Vaping is inhaling from an e-cigarette, and the essential elements are a battery, an atomizer or a heating element, and a cartridge of liquid sometimes called e-juice. There are a number of different things you can vape: tobacco, marijuana, dabs, which is butane hash oil, essentially more concentrated THC. People vape drugs of abuse like meth and fentanyl. What's the difference between smoking and vaping? Well, smoking burns tobacco, resulting in exposure to nicotine smoke and chemicals like tar. These, as you're well aware, increase the risks of heart disease and lung cancer. In contrast, e-cigarettes heat up liquid nicotine, and users are exposed to two risks: tobacco and its addictive properties, and toxicity from the e-liquid itself. What else is in these vape liquids? More on that in a minute. Let's get back to our patient. His x-ray comes back, you pull it up. Healthy lungs are black, in other words, filled with air. Our patient's lungs contain patchy white spots, which the radiologist reads as scattered ground glass opacities. What does this mean? It's a nonspecific finding, and in my experience, it can mean just about anything. A CT scan might give us more information. It is possible for atypical or viral pneumonias to cause this, as can other less common types of lung disease. But I think at this point, we have a pretty good guess about what's happening. It's most likely pneumonitis. The official name is EVALI, for e-cigarette or vaping-associated lung injury. Because there aren't specific X-ray, CT, or lab findings to diagnose EVALI, it's a diagnosis of exclusion. So we should treat him with antibiotics just in case. EVALI is typically diagnosed by pulmonologists after infectious causes are excluded by sputum cultures and other tests. What's the treatment for EVALI? Well, there's no antidote, and care is generally supportive. Oxygen if needed, a ventilator if it progresses to respiratory failure, which is possible, lung transplants in a few cases. The mortality rate is estimated around 3%. That's not especially high, but disturbing considering most of the patients are relatively young and healthy. Another treatment option are steroids to reduce inflammation in the lungs. The e-cigarette industry, estimated to be a $22 billion industry and growing worldwide, would like you to believe that vaping is safer than smoking. Don't believe the propaganda. Remember Big Tobacco's long history of lies and distortion of the facts. A ridiculous example is when an executive compared tobacco addiction to liking to eat gummy bears, and this in 1997. Vaping has only been prevalent for about 10 years, not long enough to determine its true health impacts. Big Tobacco calls the youth their, quote, replacement generation, quote, an absolutely chilling name in my personal opinion. Vaping ads are targeted to adolescents, unfortunately, successfully. More than 2 million middle and high school students were using e-cigarettes in 2023. The American Lung Association notes online sales make access easier, and e-cigarettes come in a myriad of shapes and forms, including toys, and are disguised in innocuous-looking things like jump drives, making them easy to hide. You probably heard of the company Juul, which at one point cornered 75% of the vaping market. One liquid nicotine pod for their e-cigarettes contained as much nicotine as one pack of cigarettes. They had a huge presence on social media, and at one point, almost half of their followers were teens ages 13 to 17. Let's talk about liquid nicotine, specifically a risk with vaping rather than smoking. Flavored preparations contain flavoring and solvents to dissolve the nicotine and are especially popular with teenagers. It's these ingredients, rather than the nicotine itself, that's causing the pneumonitis. Question number 3. What compound is responsible? A. Vitamin E, B. Benzene, C. Cadmium, or D. Unknown toxins? The answer is actually D. The truth is, no one really knows what's causing EVALI. However, you're not wrong if you answered A through C. There is an association between pneumonitis and products containing vitamin E. I say association because it's unclear if the vitamin E is actually causing EVALI itself. In fact, we don't even know what's in the e-liquids. The ingredients aren't listed and vary from manufacturer to manufacturer. There are literally thousands of flavors, things like bubblegum, cotton candy, berries, and dessert flavors. Others, I have to say, sound less appealing, like toast, blue cheese, milk, crab legs, and hot dogs. What we do know about the fluids is they contain many potentially toxic compounds, not even counting nicotine. To list a few, they've been found to contain volatile compounds such as benzene and toluene, particulate matter, heavy metals, bacterial endotoxins, and fungal elements. Let's take a look at a few examples. First, heavy metals. The liquids can contain lead, chromium, and nickel. It's interesting because exposure to heated chromium and nickel can cause metal fume fever in welders. This is a respiratory illness that's very similar to pneumonitis. Many flavored preparations contain diacetyl or 2,3-butanedione. You may not remember this compound, but I bet you remember the news articles about it. It's the butter-flavored cause of popcorn lung, causing bronchiolitis obliterans in popcorn factory workers. At work, we still have a sign on the microwave forbidding making popcorn, though this isn't actually a risk. A clear cause of EVALI, as I said, hasn't been identified, but I can guarantee none of these compounds are improving lung function. No testing is required on these liquids before marketing. I don't know about you, but I have only 2 lungs and I intend to use them both for at least 100 years. There's no way I'd volunteer them as petri dishes for big tobacco. The FDA did ban flavored e-liquid pods, but users switched to menthol and manufacturers skirted regulations with various loopholes like disposable products. Is all the news about vaping bad? No, actually, a recent study in the New England Journal of Medicine suggested that electronic cigarettes may be helpful in smoking cessation. Back to our patient. You admit him to the pediatric service. They continue antibiotics and order more tests to exclude other causes of pneumonitis. The next morning, back on shift in the ER, you check his chart. Unfortunately, he decompensated overnight and is now in the pediatric ICU on a ventilator. Only time will tell if his lungs will recover or if he'll become one of the 3% of patients who don't. Since watching and waiting isn't our strong point, let's talk a little about nicotine toxicity in the meantime. I knew smoking was bad for you. I didn't know 1 in 5 deaths annually in the US is attributed to smoking. That's, of course, due to chronic nicotine exposure. Acute nicotine toxicity is completely different. It's uncommon in adults. Well, I should probably say it used to be uncommon, but it is on the 1 pill can kill list for kids. 1 cigarette or 3 cigarette butts ingested by a child is enough to cause significant acute nicotine toxicity. What happens? Well, nicotine is an agonist, or it stimulates nicotinic receptors in the body. Low doses, like with smoking a cigarette, cause stimulatory effects, including high blood pressure and heart rate, nausea, vomiting, dizziness, and headache. At high concentrations, it causes the opposite effects, resulting in weakness and muscle paralysis. If you've been listening, you know the diaphragm is a muscle, and when it's paralyzed, you stop breathing and die. Liquid nicotine preparations are much, much more concentrated than cigarettes. Children and pets have died from drinking the liquids. The problem is confounded by the potentially appealing taste of the flavors. You really can't smoke enough cigarettes to do more than cause mild nausea and vomiting in an adult, but vape liquids are another story. Nixic is a relatively new term to describe the effects of exposure to high nicotine levels. It's a hashtag on TikTok and other platforms. It describes the symptoms of acute nicotine toxicity after vaping too much. The liquids are concentrated enough to harm adults. Adults have committed suicide after ingesting or injecting concentrated forms of liquid tobacco. Green tobacco sickness is an interesting occupational illness affecting tobacco workers harvesting the plants in the field. So question number 4. This illness is due to A. Pesticide exposure, B. Allergic reactions, C. Water on the leaves, or D. Petroleum used to cure the leaves. The answer is C. Water on the tobacco plant leaves contains a high amount of nicotine, as much as 9 milligrams per 100 mLs, or roughly 1 tablespoon. For reference, when you smoke a cigarette, it's variable, but you get about 1 milligram of nicotine. Green tobacco sickness is acute nicotine toxicity, and workers have the expected symptoms of nausea, vomiting, dizziness, and weakness. It's preventable with PPE like gloves and dry clothing. I came across an interesting case occurring in 2002 in Michigan. Almost 100 people became ill after eating ground beef from a particular supermarket. An investigation revealed an employee poisoned 200 pounds of meat with Black Leaf 40, an insecticide containing mostly nicotine. Fortunately, most of the symptoms were mild. But think about this. When you smoke or vape, you're inhaling a product used to kill bugs. So back to our patient again. After a few days on the ventilator, you're relieved to see he's extubated and doing well. He's receiving smoking cessation help and is expected to make a full recovery. This is a fictional case, as are all our cases, to protect the innocent, but it is based on real poisonings that occur not infrequently. The last question for today. Disney banned smoking in its own films in 2007 and for subsidiaries in 2015. What Disney movie is a toxicology jackpot showing hookah smoking, magic mushrooms, and erethism? If you've been listening, this is an easy question. A. 101 Dalmatians. B. Fantasia. C. Peter Pan. D. Alice in Wonderland. Post your answers on our Twitter and Instagram feeds, both at PickPoison1. Follow and you'll see the answer when I post it. Remember, never try anything on this podcast at home or anywhere else. Finally, thanks for your attention. I hope you enjoyed listening as much as I enjoyed making the podcast. It helps if you subscribe, leave reviews, and/or tell your friends. All the episodes are available on our website, pickpoison.com, Apple, Spotify, or any other location where podcasts are available. Transcripts are available on the website. While I'm a real doctor, this podcast is fictional, meant for entertainment and educational purposes, not medical advice. If you have a medical problem, please see your primary care practitioner. Thank you. Until next time, take care and stay safe.
This podcast is a production of Unfiltered Studios. If you would like to know more about joining Unfiltered Studios, please visit our website at unfpod.com for more information.